Hey friends, I am Dr. B.V. Rao of Usha Clinic and founder of the websites qmedicaldoubts.blogspot.in and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment, and surgery details when necessary for the medical knowledge to general people and for reference to medicos. Today I am going to discuss about the malaria, types, diagnosis and treatment. Definition. Malaria is a disease caused by the malarial parasite of Plasmodium genus, and the species define the type of malaria. It is characterized by severe chills, remission, high fever, and then remission of fever, then recurrence. The gap between the attacks define the type of malaria. Every attack causes the breakdown of the red blood cells and complications. Causes. Malaria is caused by the unicellular parasite of genera Plasmodium, the species being vivax or oval malaria, and the dangerous falciparum, the intermediate host being the female Anopheles mosquito. When the mosquito bites an infected patient, then it is infected, and the person next bitten by the mosquito is infected with the malaria. The parasite in the human host then reaches the liver of the host and matures there. It may cause symptoms in any time in 30 days or may stay latent for 1 year. Next mosquito biting the patient will become the vector again. Other modes of transmission are transplacental from mother to the unborn child, blood transfusion, and through the root of the needles. Symptoms: rigors, severe chills lasting for 1 or 2 hours and followed by remission. Fever, it is followed by high fever lasting for a few hours and followed by remission even without treatment. Sweating, it is profuse and the body becomes cold. Recurrence. Recurrence depends upon the type of the species in vivax malariae and oval. The symptoms are mild and recurs every 24 hours. In falciparum species it may be 36 to 48 hours. It is a more serious form of disease. Other symptoms include headache, vomiting and diarrhea. Complications. Falciparum malaria is the cause of most of the complications. It is usually seen in tropical parts of Africa, agency areas of India, causing infection to the locals and the travelers to these areas. Complications are cerebral malaria. When the parasite filled red blood cells, black small blood vessel of the brain swells up and cause symptoms and lead to coma. Breathing problems, pulmonary edema. The accumulation of fluid in the lungs can make it difficult to breathe. Organ failure. If the treatment is late, can cause failure of kidney, liver or rupture of the spleen. Any of these are life-threatening. Severe anemia. The parasites damage the red blood cells, which can result in severe anemia. Hypoglycemia. The malaria and the medicine used to treat malaria, quinine, as well can cause low blood sugar. Recurrence. The parasites can live in the liver for years and can cause recurrence. Diagnosis: microscopic examination of blood films for ring forms and gametocytes in the RBC and outside in the blood film confirms the diagnosis. Antigen based rapid diagnostic test (RDT), high bilirubin normal white blood cells, and clinical features confirm the diagnosis. Treatment: common antimalarial drugs include chloroquine, quinine, sulfate, hydroxychloroquine, mefloquine, and combination of etovaquine and proguanil. For falciparum malaria, artemisinin combination ACT to decrease the resistance to any of the drugs. The combining drugs include M-diaquine, lumefantrine, mefloquine, etc. Other combination is a single dose of combination of sulfadoxine and pyrimethamine. Another combination is dihydroartemisinin and fipronil. Drugs used in pregnancy. WHO recommend in first trimester quinine sulfate and clindamycin combination. In the second and third trimesters, ACT is recommended. The treatment of P. vivax requires treatment of blood forms which with chloroquine or ACT and clearance of liver forms with primaquine. In severe cases, intravenous use of drugs are recommended. Artesunate is superior to quinine in adults and children. Supportive treatment is to be given in a critical care unit. Prevention: no vaccine is available so far. The medicine used for treating malaria are used depending on the type prevalent in that area. Other measures are to keep the mosquitoes away. They are spraying the home, treating the walls of the house with insecticides can kill the adult mosquitoes that entered the house. Sleeping under a net. Mosquito nets preferably treated with insecticides are recommended. Covering the skin using pants and long sleeved shirts during dusk to dawn. Spraying clothing and skin sprays containing permethrin are safe to use on clothing, and the skin is sprayed with DEET. That's all about the malaria, and in the next video I will discuss about some other disease. Thank you.